So what does an aging face consultation look like? You know, we have patients that come in all the time who are interested in facelifts and brow lifts and lip lifts and the kinds of things that would help them to appear like a more youthful or a younger version of themselves. This is a patient of mine. When we met, she was about 54 years old. This patient had lost a significant amount of weight in the 1 to 2 years before I met her. And she noticed that as she lost weight, it caused a lot of hollowing around her temples, around her eyes. It seemed to cause the nasolabial creases to deepen. It seemed to leave her skin extra slack along her jawline and along her neck. And this is a very common thing, especially people in that age group who are in their 50s to 60s, especially with medical weight loss drugs. What we saw with her is indeed that she's got orbital, temporal hollowing, periorbital hollowing of the upper eye area, the lower eye area. It makes the eyes look aged, almost gaunt or skeletonized. We actually see that the tip of her nose is in a slightly low position. We see these deep nasolabial creases. We see that from here to here, it's like this mass of skin has basically slid down and in like this. The upper lip has become elongated and a little bit atrophic. And the last thing I forgot to mention is her brow position. She told me that she sees hooding basically laterally over the outer part of her eye, and we can indeed see that the tail of her brow has dropped down in position. So the procedures that were proposed were temporal brow lift, fat grafting to the temples and around the eyes, rejuvenation rhinoplasty, a lip lift, and the entree of this procedure would be a deep plane facelift. So in cases like this, I love it when patients take my advice and we agree on a comprehensive approach to addressing the aging face. Basically, being comprehensive means that from top to bottom, we're doing everything that we can to restore youthful appearance. And the reason why that's so important is if you leave things behind, they can betray you, basically. So if you do, say, the face and neck lift, but you leave the brow position down or a lot of excess skin on the eyes, for example, this is going to betray the youthfulness of everything else. And this result is several months later, so all the evidence of healing is pretty much gone at this point. We have no visible scars, and this is just a great outcome.